Typically, in normal circumstances, we would see this time of year around anywhere between 450 and 500 visits a day. Since COVID-19 occurred, we got down as low as 100 visits between all 8 clinics. So it was a very scary time. Did video calls with the providers, 35 of them, and trained them on TeleVisits within a week. And we were up and running within a week on TeleVisits. Before COVID, we were seeing about 8 well-child visits per provider a day. We're seeing as many as 20 per provider a day now. Since COVID, we have made a huge push to get parents signed up on the patient portal. And I've spent the past month building templates and questionnaires, and they're answering those questions 24 to 48 hours ahead of time.
The response was amazing. The parents loved the fact that, they could do this when the child was asleep and not running around the lobby or screaming in the car. And it was just as simple as going to the patient portal and putting in the username and password, and bam, there's the appointment and the questions.
Those questions are imported into the electronic health record. The doctor is able to review them, and that cuts down significantly on the time factor. We used Messenger to identify groups of patients that were high risk, patients who haven't had a well-child checkup, who needed one, particularly those patients who needed immunizations. We could run campaigns. We ran campaigns to send blast emails and messages to the patients to remind them that we are still there for them. So it's been extremely important to our practice. I don't know how we would have done it without having those tools. Now, we were using these products prior to the pandemic, but we have completely transformed how we're using them now. I mean, we're using them now like we never did before.